ADHD is a disorder that consists of three main types of symptoms: hyperactivity, which means the person has lots of energy, poor attention and concentration, and impulsivity, which means they act in the spur of the moment. These symptoms must have been present from before the person was 12 years old, and they have to be there in two different settings, so for example, home and school. There's no clear cause of ADHD, but it's thought to be caused by a combination of genetics and environmental factors. So, for example, if somebody in your family has ADHD, you are more likely to have it yourself, but it's not guaranteed. There are also other factors like smoking or medical problems during pregnancy that is thought to increase the chance of it. It's common, and around 3 to 5% of children are affected. There are many treatments for ADHD which can include medication but don't necessarily have to. The medication that we use is called methylphenidate, which is a stimulant. We don't know exactly how it works, but we think that it stimulates part of the brain which allows the child to concentrate better. Before starting the medication, we need to check for any family history or history in the child of heart problems. And we also check their blood pressure, their heart rate, their weight and their height. This is because it can cause high blood pressure, high heart rate and problems with growth. For this reason, we monitor people on this medication really closely. Common side effects are also reduced appetite, headache and poor sleep. To try to reduce these, we give the medication at certain times of the day, and we can also make lots of tweaks in the doses and the times that it's given to try and reduce the side effects. As I mentioned, there are other treatments. One of the important things that we can do is try to educate parents and teachers about ADHD and also teach them some coping strategies for managing the behaviours. We can also look at some environmental changes that might help the child, for example, sitting them at the front of the class so they don't get so easily distracted. They can also see a psychologist for some psychological therapy to help try and improve some of the behaviours.